Good afternoon, and thank you. I'm always happy to talk about the Bronx Knows, our large-scale public health initiative designed to increase voluntary HIV testing in one of New York City's most heavily impacted boroughs. I first want to set the stage and give you the big picture of what HIV looks like in New York City. New York City has the country's oldest and largest AIDS population. We often say that New York City has more AIDS cases than Los Angeles, San Francisco, and Washington, D.C. combined. This slide represents much of the history of the last 30 years, but there's much more to this story. One important aspect of New York City's HIV epidemic that this graph helps to illustrate is the complexity behind reaching the National HIV/AIDS Strategy Goal number 1, which is reducing HIV incidence. Because as the pool of persons living with HIV/AIDS increases, as you can see on the far right side of the slide, the double-colored bar graph, so does the opportunity for transmission and new infections. Now we'll travel back in time a few years to talk about why we chose to expand HIV testing in the Bronx. In 2007, the Bronx had a population of over 1.3 million people, which is larger than 11 U.S. states. 30% of the residents were foreign-born, and more than half spoke a language other than English at home. It was comprised mostly of blacks and Latinos, which make up about 80% of the population. Sadly, the Bronx has had and still has one of the poorest congressional districts in the country, with about 30% of the population living below the federal poverty line. The 16th congressional district is one of the 5 poorest in the U.S., where only 8.6% of the adults have a college degree, and the median annual income for a household was just over $19,000. So why did it make sense to start rolling out our HIV testing initiative in the Bronx rather than one of the other boroughs? From an epidemiologic perspective, in 2007, we knew that the Bronx residents accounted for about 17% of New York's population, but 1/4 of New York City's HIV infections, and nearly 1/3 of New York City's total AIDS-related deaths each year. In terms of HIV diagnosis, the Bronx and Manhattan have the highest HIV diagnosis rate in New York City, with approximately 2 to 5 times higher than the other boroughs. In addition to the epidemiologic risk, there were also a number of logistical reasons why we launched a borough-wide HIV testing initiative in the Bronx. There are fewer medical networks than in other boroughs. For example, the Bronx has 8 hospitals, whereas Brooklyn has 19. There was a history of collaborative relationships between community organizations and medical providers in the Bronx, more collaborative than competitive. As mentioned, there are just 2 major demographic groups, and where the other boroughs have many more diverse populations concentrated in specific neighborhoods, which makes it hard to target messaging during the initiative. And the Bronx is one of the smaller boroughs in terms of population, making it a more manageable place to start. Our approach, as the Bronx Knows, was a public health initiative aimed at making HIV testing a routine part of medical care so that every Bronx resident between the ages of 13 and 64 learned his or her HIV status, and if positive, was linked to quality care and preventive services. The Bronx Knows was New York City's first borough-wide HIV testing initiative and one of the largest HIV testing initiatives in the country. I want to stress that this initiative was not just about diagnosing new cases, but an equally important part was linking people to care. The key to our success included a 3-pronged approach. 1, to make HIV testing more accessible, and this was prior to our passing of the 2010 bill to make HIV testing a mandatory offer. 2, to use social marketing and social media to raise awareness among Bronx residents of the importance of knowing their HIV status. The onus of getting an HIV test was not just on medical providers, but also on patients themselves. And 3, making sure that those who tested positive, whether for the first time or because they had fallen out of care, were promptly linked to care. This is where those critical partnerships between clinical and non-clinical settings became most important. Implementation. Part of what was key to launching and successfully implementing this initiative was a good deal of planning and engaging partners that went on for about a year before the public launch. We began in July 2007 with initial outreach to providers, political leaders, local CBOs, and other stakeholders. We then coordinated HIV testing conferences and workshops and began collecting data before officially launching the Bronx Knows on World Testing Day, HIV Testing Day, June 2008. I cannot stress too much how important it is for the Bronx Steering Committee and the partner organizations for their leadership and their guiding the success of the initiative. The group itself let us know what needs had to be fulfilled and where our support as the Department of Health would be best utilized. This is how we knew technical assistance in HIV billing and reimbursement was a great need at one of our workshops.